What is therapeutic privilege in bioethics? Imagine being in a situation where a doctor has to decide whether to tell you everything about your health or hold back some information to protect you. That's what therapeutic privilege is all about. It's a concept in bioethics and medical practice, where a healthcare provider chooses not to share certain medical details because revealing them might cause you serious emotional or psychological harm. This is different from the usual rule of informed consent, which says patients should know everything about their health and treatment options so they can make their own decisions. The idea behind therapeutic privilege is that in rare cases, sharing difficult news could be too overwhelming and might even worsen a patient's condition. For example, if someone is emotionally fragile or has a mental health issue that could be triggered by bad news, a doctor might decide to delay or soften the disclosure. The goal is to protect the patient's overall well-being, not to hide information forever. But this approach is tricky because it can conflict with your right to know and make choices about your health. Ethically, it's a balancing act between respecting your autonomy and avoiding harm. Respect for autonomy means you have the right to be fully informed and decide what happens to you. Non-maleficence is the duty to do no harm, including psychological harm. When a doctor withholds information, it can be seen as paternalistic, meaning the doctor is making decisions for you instead of with you. That's why medical guidelines say therapeutic privilege should only be used in exceptional cases, where the potential harm from disclosure is very clear and significant. In practice, doctors use therapeutic privilege carefully. They might consider it if a patient is experiencing severe emotional distress, has a mental illness, or if immediate disclosure could lead to harm like suicide or severe anxiety. Even then, they often involve ethics committees or mental health professionals to help decide. The key is to ensure that the withholding of information is temporary and that full disclosure happens as soon as it's safe to do so. So, in the end, therapeutic privilege is a limited exception to the rule of informed consent. It's meant to protect patients from serious harm, but it must be used with caution. It's important that it's not used to manipulate or control patients, but only to safeguard their health when absolutely necessary. Balancing honesty with compassion is what makes this concept both complex and essential in applied ethics and societal challenges.